Nail findings are of immense importance in any patient who presents in the clinic. In fact, most of the chronic medical conditions can be diagnosed just by looking at the nails. Today, I have a patient who's actually got a mixture of two kinds of nail changes. One of them is called as a Lindsay nails. These are the ones which are popularly known as the half and half nails, which we see in about 50% of the patients who've got chronic kidney disease. And the other ones are the terry nails, which we can see in normal people as well as those who've got chronic hypoxic conditions. Interestingly, you may find them you may find both of these kinds of nails in the same patient, but usually they are present in one patient or another, but very rarely in both patients altogether. So I have a patient with me who's had diabetes for a long time with renal impairment, and the kidneys have improved now. But she has got these classic changes in her nails. In fact, both the Lindsay and the terry nails are present in this patient. So here we are, as you can see, this particular nail is what we call as a half and half nail. You can see the proximal part of the nail bed is white, which is normal, and the distal part is half and half. In a classic Lindsay nail, which is a half and half nail, we get the discoloration, which is the white bit, is the discolored bit, the pinkish bit. It can be pink, it can be brown, or it can be red. As you can see here, distally, this is the normal part, and this one is the part which is because of edema as well as chronic hypoxia. This one. And this one is seen in patients who've got not only chronic kidney disease, but you can see them in patients who've got cirrhosis as well, malabsorption syndrome, cirrhosis, as well as hypoalbuminemic states. The nail on the sides are the ones which are called as the terry nails. In the terry nails, the 80% or the proximal part of the nail bed is white, and the distal part is pink. So it can be discolored as well. It can be either pink, it can be brown, it can be red. But the proximal part is usually white, and this depicts poor circulation in the nail, which is sometimes seen in patients who've got chronic heart failure, patients who are chronically hypotensive, or any other reason why they would they would have fluctuations in their blood pressure. Um, if you glance here on this side, you can see the half and half nail as well. That's the little finger. So this is a unique combination of the Lindsay nails and the terry nails present in one patient. And that compares here as well. You can see that here we've got the half and half nails, which is the terry nails, half and half nails again. But then on that side, then we have got once again a combination of Lindsay and the terry nails, but these are the terry nails. So it's very important when, as I've said earlier on, when examining a patient in the clinic, you must take a detailed history and you must focus on their nails because, as I've said, the nails often give a clue to the underlying medical condition. Thank you.